Welcome, everyone. Welcome, everyone. Social Media Club Nashville. I'm Georgia Cross, and this is Miranda. We're the Social Media Club chapter leaders, and Miranda helps run this event. We are in the process of live streaming over there. There you go. It's fine. So, is everyone here familiar with Social Media Club Nashville, or raise your hand if you're new? Oh, lots of newbies. So we hold events once a month, focus on different topics in social media, and our motto is, if you get it, share it. Tonight we have some people in healthcare and mobile marketing that get it, so we're here to share it. We have a Facebook group. It's Social Media Club Nashville. You can do a search for it. We're smcnash on Twitter. And if you are on Twitter, please, you can tweet tonight. Use the hashtag smcnash. And also, we're on LinkedIn, we're on Google+, we are on YouTube, all the social networks. So whatever social network you're on that you like the most, look for us there and connect and join our community. We have different topics each time, so depending on your interest, it may be your industry or it may not, but you can always learn something. That's our motto, if you get it, share it. So Miranda is going to introduce our moderator.
So thank you for coming out tonight. I'm very excited about this event. We have some very innovative minds that have joined together to speak tonight. And these guys. So I just wanted to thank you again for coming out and introduce the Digital Health Solutions Manager at Verizon Wireless, Scott Kozicki.
Hello all, thanks for coming. Thanks Georgia, Miranda, and Social Media Club Nashville, and Stage Post for our facilities here tonight. I would like to introduce you to literally three of the smartest people I know. That we were able to get them all to show up and hang out, and I think you'll enjoy the conversation we're about to have. Also, I want to say that I think we should talk about fashion for a second. I didn't get to that we'd be wearing blue blazers. So the moderator would be easy to point out. But to my left is Bill Kampine. I've known Bill for almost 10 years now. We've worked together at Healthways. He was instrumental there, and he is the founder of a company called the Healthcare Blue Book. Healthcare Blue Book is an app and a website that allows you to look for the price of any medical procedure in your area or any zip code, basically. So if you want to check and see how much an MRI is going to cost for a particular procedure, you can hit them up and they'll tell you what the cost is for all the providers in the area for that particular service. To his left is Jacques Woodcock. Jacques is he's tweeting right now.
Taking notes.
Yeah, he's one of Nashville's elite and star developers, very well-respected guy, who's also the founder of a company called Sucratrend, which is an innovative product that allows people to manage their diabetes, their blood glucose, through text, through a mobile app, through the web. We'll talk a little bit more about that. To the left is Dayani. John comes from a long line of superstars in Nashville. His family is very well known as doers and innovators here in Nashville. His company is called GOBA, Go Out and Be Active. It's a mobile engagement platform. Originally it started to help people just interact with each other in real life using social media rather than just tweeting or texting to each other. And now they have a mobile-enabled engagement platform that is really used for employers or special interest groups to move people together. So I'll start off with asking the question, why is mobility important to your project? And I'll start with Bill.
Sure. Well, again, Scott, thanks, and thanks everybody for showing up tonight. It's really great to be here. So I'll preface that with just a little background on our company and what we do. Our company is called the Healthcare Blue Book, and we are what is called the Healthcare Price Transparency Company. And so as more and more employees across the United States have to pay more and more out of their pocket directly for healthcare, either through consumer-directed health plans or through your high deductible, it is more and more important every day for patients to understand what healthcare should cost. And so The challenge for us is that for patients who have insurance, and this could be Blue Cross or Cigna or Aetna or whoever it is, who are using their benefit and are going in-network for a service like an MRI or your child's tonsillectomy, the actual price, the price that your company pays, that is the negotiated price, not the bill charge that the hospital originally charges, but the agreed upon rate for the network can differ by as much as 200, 300, 400, 500%, depending upon where that patient decides to go for care. And despite the fact that there's a 500% difference in the price of the service, there's virtually no difference in quality. And in fact, the evidence that we have about cost and quality not only shows that there's no correlation, but some of the studies suggest that, in fact, there's an inverse correlation, which is to say that the more expensive the care, the lower the quality of the care that the patient receives. So what our company does is we provide the tools that help patients shop for care and find prices and compare quality on providers in order to get the best value. And so what that means from a mobile standpoint is that for us as a company, it's been incredibly important to begin to develop mobile applications because we have patients who may be in the doctor's office and your doctor says, hey, I'd like you to have a CT scan or an MRI scan. And instantaneously, and incidentally, patient, I would like you to go over to location A for this service. And before the patient even has to leave the office, they can take a look at it and they can understand directly how much this is going to cost, whether this is an exceedingly expensive venue or more cost-effective. Yes, question?
Does that factor in like your insurance too?
Yes, yeah, absolutely. In other words, what you are paying for.
Right.
But more importantly, it's the overall cost. I mean, what you pay is a component of it. If you have nothing out of your deductible, you have to pay all of it. Or it just may be a portion of it, but it helps you figure out instantaneously, and you can ask the doctor. You can, in effect, alter that path of care and say, hey, could you send me to one of these alternative locations? That's for a patient. It is equally as important, as we are discovering, that physicians have these tools at their disposal because their patients are coming in and saying, hey, look, I'm going to pay for this out of pocket. It's important to me to understand where I'm going. Is it expensive, inexpensive, or those type of questions. And we now have doctors using the mobile applications to make sure that they're sending patients to the most cost-effective, high-quality providers in the network. So, I'm sorry.
What about you, Jacques? How's mobile important to Sucratrend?
Well, chronic disease, so diabetes is a chronic disease. And chronic disease is a 24-hour-a-day, 7-day-a-week affliction that you have to take care of it. It affects all aspects of your life. And so to manage that, you can't rely on sitting in front of a computer or some other type of stationary technology. So mobility is the only true way to manage that in a successful manner. You need to be able to access that tool where you're at when you do take your glucose measurements or you're eating, because we track carbs and insulin as well. So for us, it's the cornerstone of actually successfully helping somebody manage their chronic disease. Our tool, as you mentioned, is a glucose tracking solution, but we also capture insulin and carbohydrates. But the key to our service is that we try to provide a solution that is low cost, accessible to no matter your social demographic or social economic situation or your demographic situation. And so for us, what we try to do is pin it on a technology that our audience already owns and uses every day, and that technology, is SMS and dial-in phone numbers. And so the diabetic, if they're 80 years old at home and don't have access to a cell phone or a smartphone, especially a smartphone, they can easily just call into our service and report their measurements, and then we do the trending over a period of time, and then we can also give them feedback on how well they're managing their diabetes. So if they're going high on their glucose, we can warn them prior to chronic chronic blank on the word there.
I probably should have kicked this off in the sense of framing why healthcare is so important and why we need innovation and we need new tools for it. And that is, it's incredibly expensive in the U.S. and globally. We spend $2.6 trillion in the U.S. every year on healthcare. And out of that 2.6 trillion, about half, 1.1 trillion, is spent just managing chronic illness. And inside that, about $460 billion, almost $500 billion, is spent managing just 4 conditions: diabetes, CAD, COPD, and CHF, congestive heart failure. COPD is a respiratory illness, and coronary artery disease. 4 preventable conditions, almost $500 billion. Okay, so the taxes that you just spent this past week, about 40%, or 40 cents on the dollar that you paid, go to pay for just health care. And so it's, we hear all these topics on the news about sequestration. I'm going to ruin it now.
Sequestration.
Fiscal cliff. And, we can't afford to do this, and we're in debt, and blah, blah, blah. And one of the biggest drivers of that is our healthcare costs, along with the fact that the baby boomers are starting to enter in the time of their lives that they're going to consume the most healthcare dollars over the next 20 years. So if we don't have tools like this, 2.6 trillion represents about 17% of our GDP. It's expected to go to 20% of our GDP in the next 3 years. Where is it going to go in the next 10 years, right? Got to do something.
In diabetes alone, it's expected that 1 out of every 3 kids born in 2010 will end up with diabetes in their lifetime. So just think about that. Look around how many people in this room, and you can do the math. So it's and to cut those costs is all about information. What prevents worse diseases? So the issue with diabetes, and the reason that we want to tackle it first beyond the fact that the co-founder is diabetic himself, is that diabetes is one of those gateway chronic diseases that lead to the other ones. So diabetes is typically resulted from obesity, which obesity leads into respiration diseases, which leads into the heart diseases and all that stuff. So it's the first gateway that you're going into a very highly cost situation when managing your health care. And so because it's one of those things that affect you every day, every minute, every second, you can't rely on a technology, adjusting your life for a technology that's going to help you manage it. It's about providing a technology that doesn't intrude in your life, that can help you manage it. And so that's where the mobility becomes important for us. As otherwise, you're just going to your doctor every 3 months and hope you're doing okay.
Well said. Well stated.
So, John, to ask you what does mobility mean for GOBA is kind of silly, since it is all about mobility, right? But let me rephrase that question a little bit and say, why does mobility matter at all to anyone, right? We live in a world where we're rapidly using smart devices. What does mobility really mean? Is it just about a smartphone app, or is it more than that? I thought I'd throw a hardball after 10 minutes.
You thought sitting at the end was going to be
Yeah, right. I'm closest to the exit, so I can run. So I want to answer. The reason mobility is important is because none of you are sitting here taking notes and staring lost away in your laptop, and all of us probably think, like I do, that my laptop is going to be extinct, or it's really nice to have and be wherever. Mobile, especially over the past 3 years, when we got started in 2009, I think there was about a 30% penetration that smartphones had in the marketplace, and that's now near 60, lagging behind countries overseas, which is another discussion. We have all this power in our hands, and so the ability to take advantage of that, to save costs, have better care, and basically you guys are empowering the end user, the person holding the phone, to expect better results, pay less, and yet healthcare is antiquated in how it's not an innovative arena, though you could argue that to some degree with these really large multi-million-dollar scanning devices.
Healthcare uses technology, but healthcare doesn't practice technology, right? We have lots of technology in healthcare, but we don't have a lot of information technology.
And it's not very consumer friendly.
Yeah.
Well, right. In management in itself, right? it lends itself to a more slow type of process of change because of its real life, right? So you want to err on the side of caution, but the truth is that with the cross-section that we're at now with the technology and the accessibility and the mobility is that we can truly see some innovative things to not only help what traditionally works, but to expand upon it.
So if you're a hospital and you're going, all right, we got to do something mobile, right? And you go, well, let's hire some app developers, and we'll, I know a kid, right, to develop an app for us. Well, what is that app going to do? And what app developer wants to, of all the options out in the space, it's, working in a hospital, I don't know that's going to fall if they're high on their list. So you've got a really big challenge to go mobile. Yeah.
Got a question. Who are initiating those discussions? Is it coming from marketing? Is it coming from CEO? Is it coming to have those?
At a hospital?
Yeah, at hospitals.
Well, all of a sudden, so I was made aware of some folks. Well, I was made aware of this survey where this company asked their clients, their hospital clients, hey, how important is mobile to you? And all of them resoundingly said, we thought it was this far off thing that we needed to do, and all of a sudden we find that we have to have it yesterday. Right? So, which is great for me because we've created a platform that will allow hospitals to engage their audience, whether it be their employees or patients, in a much more engaging format, which we could talk for days about what does that mean as far as engaging, and I'm glad to elaborate. But the discussions are coming from everybody from the marketing department who has, here's their dilemma. They've spent the past 15 years, someone's convinced them, hey, you got to have a website. So they bid off, they bought a website, and then it's got to be Java-based. Right now it has to be mobile-based. And you got to have a Twitter feed. And, well, why? I don't know. But they got to have a Twitter feed at the hospital. And we got to have a Facebook presence, right, for our patients. And so, every 2 years they're coming and someone's throwing a new expense at them as to how they have to do something. And now all of a sudden they need to go mobile. But the nice thing about going mobile, I think it could be a lot more cost effective and a lot more meaningful to the end user versus a website. So who's having those discussions? It depends. The marketing person who's been doing all of the website development and in charge of that, and also in charge of the social media efforts, those people are having that discussions. Yet at the same time, the CEOs run around with this really cool hot iPhone. You go, why don't we need an app, right? And okay, yes sir, what's that app supposed to do? So I think everybody wants an app or wants some mobile solution, to your point. Is it smartphone, is it SMS based? They can't come out with a mobile solution and just say, oh, we have an iPhone app. Well, what about the Android apps?
So does,
Probably didn't answer your question.
can I answer or ask almost the same question on social? I mean, I'll get to whether they're different or the same in a bit, but how does social impact what you're doing with your project? Does it impact? What does it mean for you? Is there a social media component to Woodcock? Do I want to tell everybody on Twitter that I just saved a bunch of money?
Oh, cool.
So, this is one of those questions I think that's, particularly in healthcare, it's a little bit thorny because of HIPAA and privacy and the reluctance of people to have their data free and available through social media. And a lot of companies have a lot of different points of view on this. I think for us, for the time being, where we really focus is more on the mobile end of it and not so much on the social media. Now, that doesn't mean that that's not going to be a core component of this as we move forward. I think right now, today, there are other venues that as we look at that problem, I would prefer to integrate with other solutions that allow people, broader communities, to share their experiences, whether it be with a particular physician or to talk about their condition or something that they were charged. And there's a lot of reasons for this. I think philosophically we like to integrate with some of those other solutions because they draw from the universe of patients and their experiences. Whereas as a company, Blue Book, we don't want to limit that just to our users or our clients' users, which are large employers or insurers or folks like that. Having said that, that portion of social media is going to be, I think, important, interestingly, both from the patient point of view, but also to a certain extent, I believe, from the provider point of view in the future. And here's what we see happening. As prices become transparent, as hospitals and provider organizations understand that patients have a growing concern and pay a greater portion of first dollar coverage in their care, they also want to make sure that they're reaching those patients. If you are a good value provider right now, and we're just in the nascence of this, but if you are a provider that charges the best price in town, you have equivalent, if not better quality than anybody else, you want to grab as many of those patients as you can. And there are a whole lot of hospitals, let me tell you, who want this to go away, right? Nobody should know the price of anything. You don't need to know the price, you just need to know the quality. And so with respect to social media, I think more important than the patient, we are beginning to see providers that are using it to say, hey, look, I offer the best value and I want to grab as many of those patients as I can. And I'm sorry, there was a question.
Yes, well, how do you promote your service to patients and what is your, how do you make the money basically?
Yeah, there's a distinction, and I should have said it when I asked our question, between using social media as a marketing engine for what you do versus embedding social in the service that you're providing, right?
Forgive me, I answered it from the standpoint of how social media affects the model.
But it's interesting that you went with, how physicians are using that to market themselves on social.
But just, let me answer the question. Just our company, we serve a public service mission, so we provide an application that's free for anybody to use. That is not a shopping application. So what we do in every market in the United States for many, many services is help you understand, okay, what does an insurance company pay as a fair price in this market for this type of service? Our core model is to provide tools to large employers and TPAs and insurance companies and provider organizations, and they receive a customized version of what we do that allows their employees, okay, I need an MRI in my network, this is what it should cost, and here are my options for locations. And so that is the revenue model that we use to support our business. However, we do still, yes, we serve this public mission.
It's kind of a freemium model. You can see what the insurance companies pay in a given area. If you want to know what an individual payer would charge you as a consumer, or somebody has to pay.
So one follow-up question. So how are you marketing to the decision makers? Are you using pay-per-click, advertising, direct mail?
And so by specifically to who's the audience?
The decision makers at the large employers and the associations you were just talking about?
Sure. And so you may have seen this recently. Time Magazine ran a cover article on why does healthcare cost so much. The underlying trade current here for employers in the HR world is we have many, many companies across the United States moving their employees from your traditional pay $20, eat as much as you want, go wherever you are, to, okay, you now have to pay the first $3,500 out of pocket, and then it's 30 cents on the dollar until you hit $7,000. Those employers are more or less coming to, we market to them, yes, through trade publications and HR and media outlets and things like that, but by and large, whereas this was, and as I was telling my colleagues just prior to the event, this was virtually unknown among very, very well-trained men and women who managed $50 million, $100 million benefit, healthcare benefit spends. As recently as 4 or 5 years ago, they had no clue that an MRI might cost $3,000 in this building and $450 in this building. And so this is a phenomenon that has occurred over this transparency phenomenon has occurred over the last 2 or 3 years. And so those folks are a ready-made market. They are now ready to understand, okay, this is going on. We need solutions. The carriers are not bringing tools to help my employees solve this problem. So that.
Okay, thank you.
Are you using like social media or LinkedIn or anything to go after your target audience to sell? Is that a question?
Yes.
Absolutely. And we don't make as effective a use as we should and could.
You should talk to some of these people.
All these people out here. I know I'm in the right spot. So, but yes, that is a core part of what we do.
We have a great product, that's for sure. It sounds like it.
Thank you. That's kind of you. Yes.
Checks in the mail.
Yeah.
Well, a really quick follow-up question.
Yeah,
So you
sure.
talk about how you market to the decision makers, but how's the department paid for it? Do they pay per patient, per?
Correct, yeah.
Okay. I mean, obviously they perceive there's going to be some
Yes.
savings, and so they get a percentage of the savings?
They get all the savings. We charge a nominal fee per employee per month for the service, and before we even engage our clients, we take their data, we show them what is going on. Sorry, this shouldn't be a commercial. Then show them what is going on in their networks and their areas and how much can be saved, and that's fundamental to what we do. Yes.
So from like the customer's aspect, from like, I don't like that, that's kind of.
Sure.
I don't see like you can't
That's
put it in
social media right
your
there.
insurance provider, so I can't exactly see who's in my network and who I can go to.
Correct.
So is there, like, for instance, you do a custom application to Cigna, and then through then you can download an app
Yes.
that's customized? and you can
That's
install
exactly
it?
right. So for you're using the free version that
Yeah.
just tells you, and you'll look up an MRI, and it'll be a no dye contrast MRI, and it'll say you should pay maybe $650.
Mhm.
In your network, if you have insurance in this market, there is a provider or multiple providers that charge that fee. You have to call around.
Mhm.
If your employer sponsors Blue Book for the benefit of their employees, you would actually have the app that would allow you
So
to.
you don't do it by, I guess, insurance, the company as itself? It just has to be like, whoever you did it through?
Yes, it's through your employer that typically sponsors it unless the health plan is using Blue Book as the name.
Okay.
Okay, so Jacques, social media, is social important to Sucratrend?
Yeah, so-
Not from a marketing standpoint. like-
No, well, I mean, let me talk about it on both sides, actually, because, I think there's two clear avenues for social media when it comes to Sucratrend. One, there's building credibility in our service, because we have a civic mission that we want to do. We want to help diabetics manage their disease and live a healthier life. That's the soul of it. We have a free program as well that diabetics can use to do it. We have some paid models for advanced features. We also have a physician paid model and then a payer paid model, which has other features and stuff into it. But from a social media standpoint, first and foremost, we use it as a credibility building tool because we're a new company and we talk about our mission, why we're doing this. We're helping people. Hopefully get the word out there so more diabetics will actually jump on and use it and better manage their disease. And then there's a separate aspect of it, and that is because diabetics is a chronic disease, there's a social media need for a peer network, right? And so we kind of fall in between those two areas, right? There's our professional need, we need to get in front of customers and people need to buy this. But because we also have the civic need to help diabetics, so we have to pay attention to that peer network, right? And how they're using social media to, benefit themselves, or that they're having a bad day to get themselves picked up and so forth.
Got everybody.
Right, exactly. Is that something that we want to integrate into our tool? I think right now you're seeing a lot of people staying away from that for a number of reasons. In the healthcare industry, the privacy concerns are just, especially around the social networking aspect, it gets very, very difficult to answer those or to handle those, and a lot of liabilities around that. But, is that something we're aware of and we're watching? Yeah, definitely. Could it be an enhancement to our tool? Definitely.
And that's ironic because that's really what GOBA started off with, right? Is me trying to find buddies to go do stuff with, right? I want to go play hockey. I text a couple people through your service, hockey, 6 o'clock Saturday, in or out, and you connect me with people, not just people I know, but people I don't know that I should meet because we have an affinity.
Yeah, so as an offering to our platform, we allow the owners of the program or the app that we create for them or what have you decide if something's public or private. And so we're very keen on people's privacy and allowing folks to sort of engage with each other in that private setting. But for example, in the healthcare setting, if there was an event I curated or created for my audience, a patient said, or at large, we would easily give them the ability to share or tweet that event, or maybe a group. So hey, I found a really great group that my hospital created for me, and I want to let other people know about that. We can allow that to happen and keep it public or private, and then allow them to pre-can a message to has some controls over that. So there's a big, which is highly fascinating in the healthcare realm because it's something they don't know how. They're not really adept at trying to figure out what is social. Is everything social? Do I need to, am I really excited that there's a screening going on? I want to share that with the world and.
Right, it's like bridging that gap between marketing and actual engagement.
That's right. So from a branding standpoint, getting it out there, how do we help them leverage social media appropriately, right? But as far as our company is concerned, I think we did all that to be legitimate, and now we spend less time on Facebook and Twitter. By all means, and we spend more time on LinkedIn. I could talk for days on the value of that, the ability to sell. Your question earlier, you get to the decision maker in a matter of minutes, but it used to take me 15 years ago, focused, intentional effort, that 3 or 4 days I could get to the decision maker. And now it's
15 minutes.
If that, it's unbelievable. In fact, I wouldn't be sitting here going for LinkedIn.
So I mean,
Have you used LinkedIn advertising much?
We've looked at that, but and they've given us free offers. We kind of did it when we had this consumer-oriented app out there, which is out there and it'll crash on you, so don't bother downloading it because we haven't touched it. But and then we haven't really revisited that in this new model. We've really made this pivot over the past several months. However, having established connections, I can say, oh, you know what, I should sell to this company, put it in there, figure out what connectivity I have, either call that person and see what they think. Or I got an email from the world's second largest mobile carrier that I thought was spam. Don't you always? Ended up, yes. Well, it was this. I'm from Singapore, and we want to talk to you about your technology. And I'm like, no, delete. Anyway, so I've got a real fun story centered around that. But not the ads. I haven't done. We don't have something set up.
So you all touched on
question
it.
right
Oh,
there.
sorry.
Well, just real quick, I don't think I completely understand the app well enough to understand some of what you're saying. So it's kind of like Meetup. I mean, use that maybe as a basis of comparison for me at least.
Sure, Meetup would be a great place to coordinate and organize events centered around an interest, and there's a fee model centered, and I believe it's primarily web-based, probably with a mobile web offering that might even go through that. Is that a fair assessment?
Yeah.
I've been so head down, I've not looked up to revisit Meetup. And so right now, our app is centered around, okay, I want to build a group. So if you think of grouping like Google Plus, you go, and these groups are very static, right? They say sign up, and then hey, you're on Google Plus, I want to look at your family, or your friend, or your coworker. And you're not going to spend the time to intentionally manage your groups, right? I would say predominantly. So what we found, our app would say, hey, the best way to group people is to feed them something to do, right? So you could go within our app, find something to do, and then like, for example, I do a manly movie night on Monday night after the kids are down, right? If I'm going to watch Transformers, my wife really doesn't care to watch the Transformers, but I know some guys. So if I were to schedule a meeting...
I've been invited.
Sorry, yeah. But see, it was private because it was none of your business, so until now you really had no idea. So our app would say, hey, let's create a movie night, manly movie night, Monday at 8 p.m., and then we assume the people you want to be with, you carry around in your phone. So you can rapidly tap those folks and send them an email, a notification, or an SMS, and then invite you. But ironically, all of a sudden you basically created a manly movie group, and your mind naturally gravitated to group those people, which we found, hey, that's a much better way to group people than trying to force a group in social media. I can tell you why the app didn't work, but I can also tell you why in Singapore we took the same technology. Singtel had all this curated content. If you want to do something tonight or this weekend, from clubbing to family activities to the arts or to movies, they already curated all this content. We took our technology so that you could, through the app, find something to do and rapidly mobilize your friends to do it, right? And if you wanted to tweet it or post it, you could do that as well. It's just that when you tweet or post an event, you're competing against his picture of his dinner via Instagram, right? And you're not going dinners. Right, he does. Very hip and vegan. So, now we take that same technology, and I can say, sit around groups and events. So I don't have an app anymore. I empower. I have a platform. I have an API library and a killer team that can help you create your own app of engagement.
You're all about building apps for some particular brand or constituency now. Now you have the platform that will set to do
So,
yeah.
You're the organizer.
So I want to get back to something that all of us mentioned, and I was going to say it for the big finish, but it needs, I'm going to punch it on the nose right here, which is the privacy aspect. I mean, we argue about it, talk about it when it comes to social media a lot, but in the convergence of social and mobile with health, is that really going to be a problem? Because we spend a lot of time, money, there's a lot of fear, uncertainty, and doubt around privacy when it comes to health. Most people misunderstand the HIPAA regulations completely, even people that that's their career, is to understand that. They don't even know how to spell HIPAA. But is that going to be an impediment to some of this stuff taking off? Do I want to share on Facebook that, I just had a tonsillectomy? I was going to say something.
That's some sort of activity.
Way to clean it up.
Right? You want to clean up that activity.
Jacques, what do you think?
No, I think I think with this whole push toward not social media but connection, right? The technology's leading us down to. Social media is just a facet of that. We're still private beings at the core. I mean, there's things that we don't want to talk about. And we have different degrees of personal privacy that we have as individuals. Starting, health is way down that trail of this is private, right? So, you don't want to say, I just got diagnosed with something on Twitter, typically. You say that to your friends first, and then you get out of some comfort zones, and eventually maybe, if you have a very active communal outreach on Twitter, you might say something about being diagnosed with some type of, disorder or something like that, chronic disease, whatever it is, Tourette's and Scott's taste. So I think we're always going to have that as beings. We have these different layers of privacy that we want to have. The question is, do we have that? And that is a wholly another question, right? What privacy do you actually have these days? But I think before HIPAA, you even hit HIPAA, you've got to go through these personal layers of privacies that you have, and then there's opportunity in each one of those. With GOBA, we're clearly hitting on, I want to go see this movie. Might not be appropriate to put on my Twitter stream because I might be youth leader at a chapel or something like that. But I do enjoy Transformers and some other, more adult type stuff. So I have my personal group who, I know trust me, and I trust them, and then I can keep them within that context or within that privacy box. Circle of trust. And then you can go out from there. And then eventually, when you have those rare cases when people don't have as many layers or layers of everything, or they're just not there, and then you have to hit the HIPAA. I think for a lot of the health specific things, the HIPAA is actually so far outside of the layers of privacy that the first hurdles are those individual privacies, and then you get to the HIPAA ones. I can see in Sucratrend's case that if we ever integrated some social type of peer network into it, there's a connection and a legitimacy for that. But I think when you go to pricing, MRIs and stuff like that, who are you really going to share that with? I mean, at this day and age, I can see 15 years now when actually transparency does happen, and you're kind of shopping it like you're shopping Target versus Walmart or something like that. Hey, if you need, the regular checkups, but even that's going to be limited by those personal privacies. An MRI is a very serious thing. Colonoscopies are very serious things, and they give so much more inside of an individual's privacy and what they are internally, and that's a lot of what people protect.
But isn't there an interesting combination? Because essentially, Facebook and almost all social media platforms, what they're really trying to do is gather that social interaction across a big population so they can target ads and market you, right? So isn't there a situation where I know that you have diabetes and I want to use his tool to market, a glucometer to you?
Sure, I mean, in that situation, but I think you have a private relationship at that point. You have my relationship with the service, and that stays a one-on-one private relationship. It's not my relationship with, 1,000 Twitter followers I have, which is a totally different interaction type of thing, right? So, I don't know if you're ever going to sell that. That's an interesting point there, but I think on the diabetic side standpoint, we don't have any intentions there doing that, right? So our core is, if it helps, how do we help diabetics better manage their disease, and if a peer group, online peer groups serves as one of that, something avenue we want to go down to, I don't think we'll ever pervert it with advertising.
I don't know if you guys are using Google AdWords or other targeting, but that's a prime mechanism right there for you to say, if somebody's searching for an MRI or for a particular procedure, there's all kinds of stuff.
So ultimately, whether it's through our current business model with employers and insurers, or ultimately altering the model that we have that is right now the freemium model, we want to put patients who want value together with those providers who want value. And inherent in there is the patient wanting to express, have their desire, the thing that they're looking for.
Right.
I think the key is to give that individual control over what it is they want to share.
Right.
And that is absolutely our perspective on it.
But it's interesting that you say it that way, because you are facilitating a market between point A and point B around this particular transaction, but there's a whole halo of other interest in that transaction or other transactions that can spring off of that. How do you resist the temptation, I guess, might be the best way to put it.
So for us, that's not the business we're in, right? The business we're in is this helping people shop and find value personally for the things they're looking for. That's specifically why we don't have a strong perspective. If you want to connect somebody to a social network, we would integrate with some other provider of that service, but Blue Book doesn't do that.
And you do that now, right?
Correct, yep. As needed for clients.
With Angie List?
Correct, yes, for example, would be a great example.
Right.
But that's not our model, and our pathway is not to generate that noise out of the system. We have a very clear and distinct, mission for what it is we're trying to do. Now, I don't know what others, there will be other people who pop up and have that, but that's not.
I think you'll find a lot of that around the publicly traded companies.
Sure, there's less scruples there. But it's not even. Sometimes it's out of your control in a lot of ways. There's plenty of people that make money off of the APIs or off of the marketplace without. Craigslist is a perfect example of that, right? Lots of people build stuff that essentially is a parasite on top of Craigslist that adds value because of the marketplace that's there. So you may not be able to control it that much. I'm pushing on, not to get you to commit, but more to understand, how would you defend against it? Would you defend against it?
Well, you're talking about an open information situation, right? So Craigslist is clearly
Very different.
Yeah, right. So the information between his customers and the MRIs they're checking out, again, I don't think you're ever going to open that information up to anybody, right? Unless you specifically have somebody come to you with an MRI and you open up some type of ad network yourself, I don't see any point in which you would open that up to the point where you can have those parasites built on top of it. It's like there's always a way. In our particular situation, if we ever open up that information, that is HIPAA protected information. So first we're prevented from that. Now we can do trending analysis over the whole, data set that we have, and then look at it that way and anonymize it and all that. Those are things there, but the only people who would honestly benefit from that are payers or physicians, and
Or people selling diabetes equipment.
potentially. And as long as they're not doing it through our channel, there's not they're using that information to do better ads in, say, Medical Weekly, that's not such a, I think, a dirty situation in that regard. I mean, maybe that's my line, maybe I just said my ethics right there, so.
Is it worth sharing with the audience what HIPAA is? Does everybody know what that is? The health
I don't know, I'll ask the audience, how many people know what HIPAA is? Well, it's aggressive.
That just saved us
How
20 minutes.
How do we know we live in Nashville?
We keep using the acronym, right? I just want to make sure people understand.
But you use TPA.
Sorry.
So I want to talk a little bit about regulation. And it probably won't affect Bill as much, but it definitely is affecting Jacques and I. Because the FDA has put its arms around healthcare-based apps in a massive way. And there's pluses and minuses to that. But I wanted to, it could flower to John and Bill a little bit because it's not unusual that the government or some entity will come in and say, you know what, we're going to get a piece of that action. And we think this might be harming you or whatever. So we're going to,
We just found another way to justify $1,000 out of you.
right, $1,000 an hour. If you see my legal bills. But, is that, do you see that almost as a necessity with healthcare? Because let's face it, if I give you the wrong information about whatever it is you're tracking or doing with your app, and you make a poor choice off of that, I'm kind of liable, right? I help you make the choice.
So personally, I think before they put regulation on apps, they really should get like the pharmaceutical aspect together.
Yeah.
The fact that so many people are getting, 10 different medicines in there, and they get a new one, and it reacts with the other medicines, and they end up in the hospital just because the billing cycle that there's two medicines that were prescribed the month before doesn't go into the system. So one of the 3 doctors that patient's seeing knows that they're getting those drugs, and so he issues this new one, which gets to the patient in a couple of days, but doesn't get into the system. And so nobody can verify that these drugs actually don't counteract with each other. Personally, I would say that maybe the FDA should fix that first before they come to us apps. But the truth is they're not, because the apps is an easy grab, as you said. And the truth is, national healthcare is taking over. In a number of years, what we're going to see is tighter control, more regulation, harder. It's going to be a harder game to play. It's just the way it's going to go, and it has to go that way. As you said, costs are skyrocketing. And basically what happens, our government said, okay, we'll take this on. We're going to cover these skyrocketing bills, and the first thing they're going to do is regulate it until those costs get down to something manageable. And that means, finding new revenue streams by charging apps, thousands of dollars a year just to certify that they're FDA approved.
It's a very prescient view, and I'm going to leave it right there because we're going down a wormhole there. But do we feel like there has to be some regulation on the social side? I mean, we're seeing some really bizarre incidents where, kids are killing themselves because they're socially shamed on social networks and because of the horrible things that are happening to them in their personal life just blow up on this world stage. I'm going to date myself, and it just reminds me of the PMRC, and it's like, well, Prince told my kid that, masturbation is okay. Do we see that happening? Do we see their reaction to the social side of this? Not so much the healthcare side of it, but
Self-policing, right? So I think at some point we'll see a lot more. But you kind of always get the fantasy on the headline to draw you into the news channels so that they can make more money selling ads.
we're very cynical.
Yeah, well, and then, what you don't get is the follow-up in 8 months about the lawsuit that's going to happen centered around that girl's suicide based on what happened on social media. That's not going to make news. It's not newsworthy. So I think, as these things become more and more real, I think the legal industry will only benefit from it more and more. So I hope that answers your question.
What about, in your case, Bill, if you, I know right now quality is a sort of a vague concept there, but if I come in and I offer MRIs for $1.50 and, everything is dirty and it's in my trailer in the backyard, I mean, how do you sort of indemnify yourself a little bit from that?
That's getting a little bit into the details, but I don't think, merit, how we do it. No provider goes into our system that hasn't been accredited by the carrier. So that's essentially how we do it. And it's their job and their network to put the right providers in the network, and we will report quality information as it is available to providers. Now, I wish there were an awful lot more quality information that were publicly available and ubiquitous. I think it's one of the biggest problems. At the end of the day, what we really want to do is report value. And value is the intersection of cost and quality. And the quality information is weak right now, and it's not universal. And the cost industry, or the cost portion component didn't even exist, or wasn't even a dimension to be evaluated until very recently. Companies like ours and a handful of others. And ultimately, we want those two pieces of information together, and we will use the best sources that have been approved by ultimately our customers.
So if we zoom out and we think about how I set the stage of this being this massive problem, and our entire society, it's not just the U.S., I mean, globally we're all wrestling with this. It encompasses dozens of countries. It's going to affect Japan and Germany and a lot of Western Europe, actually. Is this appearance of social media and the acceptance of it, the appearance and the proliferation of mobility and the acceptance of it, is that enough to sort of start bending these problems and turning this into a solution, or is there something else missing? John, your eyes lit up.
No, you need to start from the beginning, and I can catch up with you. I got the bending, I got the...
Do you think that to make meaningful change in healthcare, to lower costs, improve quality, delight patients, that social and mobility is all we need, or is there something else missing?
You want the non-cynical answer?
Yeah, right.
Can we get one on this panel?
Go ahead.
Yeah, so I think mobility, the mobility is the key to that. Mobility mixed with technology. I think to solve problems you need information, and I think mobility provides you the access to get that information. And the particular situation around diabetes is that if you have 6 months of diabetes measurements, and then you can go in and look at it in 5 minutes and tell an accurate picture of how well that diabetic manages their disease, you can treat them properly. But if you're going into the situation where you haven't seen them in 3 months and they've got a meter full of 3 months worth of measurements, and they're taking measurements 2-3 times a day, and you got to sit there and flip through them and look for those measurements, you're going to pinpoint on the only comprehensible thing you can, and that's going to be high and low measurements. And you're going to ultimately not, I'm going to say mistreat, but you're not going to have a tailored treatment plan for that diabetic to properly treat them. And if you're not properly treated them, it leads into more healthcare costs down the line. And so I think mobility is actually that answer, mobility with technology. Yes?
I think you hit on a great point, and it's kind of taking some personal responsibility for your own well-being. I think so many people take for granted and only see a doctor when they're sick, when you really should be taking care of yourself and eating well and taking care of your diabetes, not waiting until the last minute. So I think mobility will come into play there, where people can kind of track their weight, their glucose, and their eating habits and everything else. You can even do your heart rate down, your blood pressure. And so I think it's a good point to make, is putting some of that onus back on the individual and not having to rely on the healthcare system so much to take care of you.
Yeah,
I would disagree. I mean, I would say the cynic of me says that what makes someone correct their case of diabetes, what would be the term for? Rid themselves of diabetes.
manage all you can do with diabetes.
Right.
Well,
So you've got the whole problem of behavior modification. So that's great that I can do all this stuff, but in essence, where's the pain coming from? I may want to change all this because it costs me too much.
That's where
Maybe
the
cost less.
From it cost you too much.
Right.
Yeah,
I mean,
it's-
but even still,
Well,
a lot of people aren't going to give up what they're doing in order to be healthier.
I think that's...
If that was the case, we wouldn't have this problem.
Well,
I think it's
I think a lot of people have no clue what you said earlier, have no clue what they're paying. They have no clue until they've reached the situation.
Take the whole pieces, right? So you got to look at it as a whole. You got to take the whole thing together, right? So first of all, you've got a move to national health care, which is going to focus on cost. You've got transparency in cost. You've got more costs being pushed down to the end person because companies are raising healthcare costs, because of the move to national health care. I think it's an excuse, but whatever. They're raising costs, so that's more out of the individual's pocket. So they're going to start paying attention to where that's money going. If you give them the avenue, the price comparison between services, they're going to start paying attention to that more. And I think they're going to start taking ownership in those aspects of it. And then if you lower the barrier to the self-management of individuals, the self-management
But
of their
that's
health.
really what's changed, I think, is there's always, everybody's known, most people have known for a long time that smoking's bad for you, that, eating a poor diet is bad for you, that living a sedentary lifestyle is bad for you. But now, it's very easy for me to chart that, track that, and do something about it.
Well,
and
it
it wasn't really that.
Well, and there's an added thing which we really haven't covered because we've been talking about the mobility aspect, and that is technology is getting to the point where it can enhance the behavior. Sucratrend is one of its pillars. It's three things that it does. It reduces the trending, so you're informed. It reminds you, so you don't forget to do your trending. And then third, it offers a behavior enhancement through feedback. And so if you're starting to trend into a dangerous zone, we'll prod you in that. And the cost for our users are higher, right? So if a diabetic goes too high, they're going to go blind and pass out. If they go too low, they're just going to pass out. It's serious pain in those ranges there. And so obviously it'll be easier for them to do things as opposed to somebody who's just eating too many Krispy Kreme cookies.
Yeah, to answer your question, you asked about, is this the magic bullet to help
Yes.
healthcare costs?
Thank you.
It's two components of it. That's not the magic bullet. Look, there are 1,000,001 things that you can do to improve healthcare, not only in the United States, but everywhere else. Doctors need to be compensated, all right, for what we want from them, outcomes, not for units of care, right? Not for putting as many people through the office as possible. It is possible to bring a new back device, implantable device to market that is no better, okay, in terms of outcomes than a device that's been on the market for 9 years that's off patent. But by bringing the new device, you get to charge a premium price for it. We have no clue on quality. Nobody's held accountable for quality. The benefit design until very recently has been confounded. Yes?
I mean, I think you hit on a point as well. I mean, and Scott, you mentioned it earlier. Do you see or foresee when there's more transparency in costs, sort of tiered layers of healthcare providers, where there might be the kind of low cost on the corner, and then there's the hospital base that's sort of the high,
So let's hold on to that. Let's hold on to just that, but we'll get to that in a minute. So the first question is this the magic bullet? No, there's a million things you can do. I think what's interesting about the question you asked about what Jacques does and what I do. All right, so there are two really, of all the things you can do, there are two really easy things you can do in the beginning, just to save money. The first is, nobody starts out as diabetic, okay? You start out with having bad genetics and being overweight and having bad diet, okay? The best way of saving money, all right, is to prevent people who have health risks from eventually becoming multi-comorbid, complex CHF patients who are crashing every other week. That's what you do, and it's great. And I look at what you do, and I think 10 years ago, Scott, when we first met, we could hypothesize being able to do behavior change and helping people who had diabetes. And you have to remember, my son found in my desk drawer the other day my Palm Pilot, okay? There's no telephone in it. It didn't connect to the internet. It's this piece of metal with glass on it, all right? So we could have conceived of this 10 years ago, and now we can actually help these people. That is unbelievably important. If I can't solve the quality problem, and I can't solve some of these other problems I've talked about, if we keep people from getting worse, it's going to save a lot of money. Now, where Blue Book sits is what I think is one of the biggest, easiest things to understand. Okay, you've got two services. One of them costs $3,000 and one of them costs $400. You're already sick. Okay, this isn't preventing anybody from getting worse. This is enabling people to look at two things, okay, that are effectively equivalent and manage not to end up paying $3,000 more. If you drove by a gas station, okay, and it said unleaded today, $28 a gallon, you'd keep driving, right? Nobody would stop to buy that gas when you know full well it costs $3. Well, unless you're empty, right?
Check your wiper.
Or they check your wiper. Well, so, okay, so to your question, that is what some hospitals are going to tell you. Part of the problem is look, I'm telling you, the challenge we have is because of branding, okay, and because of marketing and because of some very, very clever ways of managing people's perceptions, because I'm more expensive in healthcare, I am better quality. And I'm going to wipe that, I'm going to put new window fluid in there. So you should pay $28 a gallon of gas when there's no empiric evidence for this, okay? And in fact, the evidence that we have, or at least the literature we have, tells us there's an inverse correlation. The more you pay, the worse off in general that you are. And so these two different applications are very, very small, okay, sample of what we can do in healthcare in the United States, and you know, I've worked in Europe and Asia, and they have all of the same problems we have today. But they represent two ways of getting a huge amount of value. Help people prevent themselves from getting worse, because as they get worse, they're going to be more expensive. And for those who have to consume healthcare today, let's turn the light bulb on. Let's help them understand that there are no difference between these two things. Stop paying 400% too much for it. And I think that is the answer we can solve. It doesn't solve all the problems,
Right.
but it solves a piece.
So it's not a magic bullet or silver bullet. We do need a magic shotgun. Or, magic pellets, but those are two big things that we know work, and the proliferation of technology, the lowering of costs, Moore's Law helps with making this very, very cheap and accessible, will help to steer that. And I don't think anything's going to solve healthcare and turn it into free, right? 2.6 trillion is a lot of money. It's a big iceberg.
You don't want it to be free.
Right, but what I'm saying is that if you can just bend, that's what I meant by bending is, instead of it being $3 trillion next year, it's still 2.6 trillion.
Yeah.
Look,
It's 2 point.
it doesn't matter how much it costs.
Are you
The
getting
question is,
more
are you
quality?
getting value
Right.
out of what it is you're spending, right? And when you're paying $28 for something that costs $4, you're not getting any value out of it, when there's no difference in the quality. All it's doing is obfuscating and padding. Yes?
Actually, just to connect what you just said to what you just said. So you'd ask if we would ever have a tiered healthcare structure. Well, we do today. If I'm sick and I go to my primary care physician, they can take care of a certain number of things. If I'm sicker and I go to the community hospital, the ACA, they can take care of a larger number of things. If I'm sicker than that and no one can figure out what the hell's wrong with me and I go to an academic medical center, Vanderbilt, they can take care of a very unusual, limited number of things. So the problem is you have patients that don't recognize that and don't have the information they need to make those choices. So patients with regular problems going to Vanderbilt paying $4,000.
Well, I mean,
Patients
it's
with really
even
nothing.
beyond that. If the patient understands that they need an MRI, right? Their doctor says you need an MRI. Typically what happens is the doctor says, go see this guy. And you say, I want to see that guy.
Unless you have a mobile device.
You have a choice.
Right.
And that's what the health industry doesn't know. You have this application,
Right.
you have a choice.
So the next level of that is, do I even need the MRI? Right?
Well, that's-
They had the right information.
Also-
Even the current structure, they would make different choices and still come up with a better answer.
And to your point, there's a great movement in the United States called Choosing Wisely. And if you haven't seen it, go look at it. And it identifies commonly overused and overprescribed. Let's answer that.
Yeah, so I want to get to be a little bit more structured on questions, because it's getting up to be a volley, so.
I definitely agree that transparency is super important, because the more information you have, the more informed of a choice you can make. But if say I'm your average American with healthcare, and the $4,000 MRI costs the same copay as the $400 MRI, why would we change? Like, why would that?
A great question, and you have actually the best panel to probably talk about that, but I want this to focus on social mobility and not big healthcare policy.
But we can take it offline if you're interested.
Absolutely.
I'll talk your ear off on it.
And that's the same question around like
great
prescriptions.
Yep.
Right. It goes in the same regard.
Yeah, but social in that case, if I had a good experience, the nice thing about social, is that I can have an opinion, I can let it be known, and all of a sudden someone that's giving me a scan, if I were to go somewhere and go, I had a really crappy time at this imaging center, you shouldn't go there. that was never available before.
Yeah,
Right.
Bill and I have had that argument a gazillion times.
Yeah, like the ones that told my wife and I that we lost our first kid, and it turned out a week later that we didn't. So, yeah, that was a horrible experience.
All right, so let's not go down that road.
That's related to that point. I mean, you talk about social media and wanting to share all this information, but then we're talking about not wanting to share all this information. I mean, you know, I'll just throw this out there. I have a friend who's going to get a vasectomy soon, and I doubt he's going to say, "Oh, I just got a vasectomy. Go to the doctor so and so. This is great." I mean, you know, I get your point of wanting to share sort of a good experience, but I mean, how do you share that and sort of, you know?
Well, there are, but we haven't covered our.
Yeah, that's true. I mean,
There are dedicated social networks that are centered around disease cases. So you can keep your anonymity, and then they are being monitored by healthcare professionals to help curate or not curate, but to monitor conversations to see if we can add value and actually provide care in that setting. And then you have things like Caring Bridge, where I can actually now leverage social to surround myself with people who care and get through those, right? Because I would say you've got this mental aspect of getting better. That it's a whole lot easier to overcome.
Well, I would also say that GOBA can feel like, particularly to the vasectomy, right? It's like, so I'm a guy and I'm
GOBA does not do vasectomy.
No, but bear with me for a second. Bear with me.
That's a really big pivot.
No, but if I have you know, my age, you know, I'm getting up there. If I have a group of 10 guys who've all got it done, right? Why can't I make that a group? And
Sure.
And share it in that private
You
context?
hit on it. There's definitely affinity groups, patients like me, guys like mine.
Well, I guess I was speaking more to like Twitter and Facebook and
Yeah, right.
like the kind of real public social. You know, I'm sure I'm not as aware of all the sort of lockdown anonymous.
But Bill and I have this conversation where we've had it many times, which is, you know, the intersection of value is absolutely cost and quality. Completely agree, but a component of quality is your perception of the quality, right? If I feel like the doctor had a great bedside manner and the offices were enjoyable and I got in and out and parking was great, I may pay $200 extra for that procedure because of all the ancillary convenience there, and that dimension counts.
So my response to that is, bad doctors don't get sued for malpractice. Doctors who don't have good bedside manner get sued for malpractice. And I don't mind people taking into account their experience. I think there is no substitute for empirical quality and outcomes.
That's because you're an economist.
I know, it's because I'm a mathematician, but, you know.
I want to say, I'm hearing what you're saying, but I still think that there's a huge opportunity like Facebook, because I can go on Facebook at any point in time and hear any of my family members out of state talk about their healthcare experience at the hospital. I mean, not just diabetes, everything. And it needs to be integrated in there, because that's where you can sell that to the providers, because I can tell you, whether it's a doctor's office or a hospital, they're gonna write in all caps about their experience.
I'm not suggesting that there's not a role or a place for that. I think absolutely there is. And look, there are big aggregators of that kind of feedback today.
Well, I mean, for the sake of education as well as marketing, because a lot of these people don't know anything about privacy. They don't know about HIPAA. I mean, they sign a form, they don't really know what that means.
They don't really care.
Yeah,
They don't care.
and they spill their beans.
And the thing about Facebook is, as I was talking about those layers, is Facebook is within that layer because it's still private, right? You still, to a degree, right? It's your private network. It's your network that you agreed to share with and to let in and to see your thing. Twitter is a totally different situation, right? So I would be surprised if anybody
But you had to set your privacy settings on Facebook.
And that'll change.
But that won't.
Well, that changes. It just changed. That's how Facebook moves around.
Okay, 2 more questions.
Well, I guess, is there a way, are there parameters in using this type of app essentially to kind of scout out where you want to go, but is it going to rank, your doctor, like the doctor, and I guess kind of essentially where you should choose, not only based on money, but also based on experience and their expertise and kind of the quality of, you know,
So,
the methodology?
cost, impaired quality to the extent that it's available, but that's a big challenge. And then, yes, the third pillar, and turn off the mics and don't record this, but you were right about that. Yeah, well, take a picture quick. Is that experience, right? And,
Yeah.
and that is an important dimension, so yes.
Well, I mean, because when you're wanting to choose where you need to go, I guess you kind of want to know where they're ranking. You might not want to just go somewhere because it's cheaper.
Correct.
It's just like any other
Make
consumer
sure that,
experience.
you know,
You got it.
you're
Why do
paying
we
for
pick-
what.
That's right, you would incorporate all of those pieces of
Yeah.
information.
Yeah.
Last question?
So how do you see what's been your experience so far, how providers are managing the disaster that occurs when on social channels they're being blasted by patients? Like, I hate this doctor, he was supposed to do a knee replacement, he did a hip replacement, or, you know, I can just see these millions of disasters that can occur that physicians and facilities are having to go into crisis mode to manage because it's so viral. So what do we see going on?
There's literally just an article this week about how, I think it was in Forbes, which is doing phenomenal healthcare coverage right now. If you just want to get in on the beat, they've got a great series of reporters that are just doing really good work on healthcare. But they talked about how your doctor doesn't really want you to be on social networks. Doesn't want you talking about health on social networks because of that risk. I don't think you can't stop it. Right?
Tough luck.
People have the ability to express their opinions. That's a foundation of our society in America for sure. But that goes back to some of the quality, right? If there is a data point that somebody, I mean, you see this with any brand. It's not just healthcare, right? If I had a crappy flight on Delta, I'm chirping.
Or they grounded all the flights.
Right. Which actually,
all afternoon.
yeah, which actually happened yesterday. So I'm chirping about it, and I'm dragging that brand through the mud, and I'm hoping every one of my followers sees it, and I influence them. It's no different in healthcare. I think the difference is that a lot more damage can be done in the sense of, you know, it's not, I can fabricate or exaggerate that story, and that hurts that person's reputation as a professional.
Well, what's interesting though, in that same scenario though, a physician would not be allowed to necessarily have a Twitter profile and therefore comment or respond to the patient who may or may not be telling the truth about their treatment.
Right.
Then all of a
big
sudden
difference.
he's in breach of HIPAA
Yeah.
because I'm now talking about a diagnosis or a case, so he doesn't really get this.
It's an unfair
So
advantage.
that's what I
Right.
was thinking, like, is there any way to manage that? Because then you are breaching.
A
but
brand
then you
can fight back.
respond and try to
Yeah,
prepare
a brand
your
can fight back. If I'm an airline and somebody, you know,
Right.
Comcast, I love following Comcast Cares because it's just flame.
Comcast really does.
And there's somebody going like, we'll call us. But a doctor can't do that. A doctor's
Exactly.
defenseless in that situation. And that'll be interesting to see how that works out.
I think transparency on a greater scale is going to help that, right? Because then there becomes some sense of accountability for the person making claims. Right now, there's no sense of accountability.
Right.
You're just in the court of public opinion, which is a very dangerous place to be.
Okay, one more question.
I just want to ask, in all of your areas, in your experience, are there any areas of healthcare that are the most desperate to be revised and changed? I'm thinking of the Veterans Administration problems, things that could be solved immediately. That really there should be a lot of money put toward right now. What would you be focusing on?
All of it. No. But if you had a magic wand and you could fix one thing, what would you fix?
Honestly, if I was going to pick one thing, and I've thought about this for years, is I do pricing comparison. Because the thing is, the health industry is a consumer market, right? Just like gas is a consumer market, but yet it's got the shield of privacy around it that protects it, that allows it to inflate its pricing, that allows it to take advantage of like regulations and all those different things. And the first crack into that is going to be transparency in pricing. And if you get that to the consumer hand, a lot of that this shawl or whatever just starts falling down off of it. And then we can start looking at all the other issues.
And that's funny because I would look at, you know, preventing diabetes and or helping them manage it and make it better by allowing someone to find ways to have a more active lifestyle centered around. But in essence, a lot of these, half of the healthcare costs are really centered around this society that's more latent, consuming, not active, and easily entertained by a screen, and therefore, like all of my children, if there's a screen anywhere, they are zoned out. You know, if I were to hand them a Coke and some candy, they would be so happy, and then they would wake up and it'd be awful. So that's the route I would go.
Yeah, I think, you know, because I think you're
Price and
saying the
quality, transparency are important for patients as consumers. I think it's also important to consider how we pay for healthcare, how we compensate doctors, how we compensate facilities. Are there better, more effective ways of doing this to get what we want, which is better integrated care for patients over time, which will result in better long-term care for the diabetics, as well as those people who have acute immediate needs. So.
Yeah, mine would be just misaligned incentives is really what's killing us. Not just on the cost side, but on the outcome side. It's the way the dollars flow through the system, everybody's incentive is to not help you be healthier across the board.
Continuing the theme of cynicism.
Yes, yes. On that note, we'll end. Thank you. Thank you very much to the audience. Fantastic questions, really engaged, and we appreciate that.
Just want a special thanks to JT Barcom for helping with our audio this evening. Otherwise, you may not have been hearing so well. And happy birthday to Christine. And also, next week, we will have some of our members of Social Media Club Nashville called the Socialites. We will be at TechBuild, that is the National Technology Council's annual conference. And if you are on Twitter, if you cannot be there, follow TechBuild 2013. We will be tweeting live from the event.
Hopefully getting number 1 again.
Yes, last year we trended number 1 on Twitter in Nashville for TechBuild, so we will be doing that again this year. And we appreciate everyone that joins in the conversation, even if you're not there. That's the joy of social media, is you can hop on a hashtag and actually have a conversation. And then May 4th, Social Media Club Nashville, we will have our own event at PodCamp. PodCamp is an event that will be going on the same day. I think we have some of the PodCamp crew. Yes. So that is, what time does PodCamp start?
8.
8.
That's for the volunteers. Yeah, the volunteers will be there.
So it's an all-day unconference at Hotel Preston, and Social Media Club Nashville will have a panel of corporate brand marketers from Nashville. Nissan, Bridgestone, CMT, and Universal Music Group will be our panel, and it will start at 2:30, and smcnash will be our hashtag again for that. So thank you everyone, and thank you to our panel. Dismissed.